Well, friends, after over 4 decades of struggling with various chronic health issues, this week at Mayo Clinic, I finally got my formal diagnosis that ties it all together and explains basically my whole life. I was diagnosed with Hypermobile Ehlers-Danlos Syndrome, and let's talk about it. But first, can we take a moment to appreciate my t-shirt? It says, "I have issues in my tissues, and I am haunted by hypermobility." Ehlers-Danlos Syndrome, or EDS, is a connective tissue disease that you are born with. It can either be inherited from your parents, or it can just be a result of a genetic defect or mutation that happens before you're born. And it basically impacts every single system in your body. It is a connective tissue disease, so as you can imagine, it impacts the way everything connects in your body, specifically how your body processes collagen. I do want to give the disclaimer here, although I'm sure it'll be very apparent while I'm talking. I am not a medical expert. I am not giving anybody else medical advice. I am just sharing with you what I have learned during my journey and what I've been told about it and my experiences with it. So with that disclaimer out of the way, basically a good way to think of EDS is, in a normal person, your connective tissues and your joints and everything have a certain normal range of motion, and everything is held together nice and tight. Well, if you have EDS, it's all loosey-goosey instead. See what I mean about the whole medical expert thing? But that's the best way I can describe it. Basically, my collagen, instead of being nice and firm and tight the way it should be holding everything together, is much more elastic, resulting in much more bendiness and overextension of your joints. Here's an example. Most people cannot, well, you can kind of see my deformed pointer finger too, but most people cannot bend their pinkies that far. That's actually one of the joints that they look at when they're doing your hypermobility assessment on what's called the Baton scale. I'm not going to get into all of the diagnostic criteria in this video. If you are interested in learning about the diagnostic criteria for EDS, I can certainly do a separate video on that, so let me know below. Because of the fact that your joints are hypermobile and have much more range of motion than they should, it results in your muscles having to work harder. Basically, your whole body 24/7 is trying to hold itself together and working much harder than it should to do so, which is why there's a lot of sleep disturbances associated. Your body's never really able to fully rest and relax to recover the way it needs to. It's basically in a constant state of stress. And because your connective tissue literally connects your entire body, it impacts your skin, your nails, your bones, your blood, all of your organs, your GI tract, your central nervous system, you name it. So it literally impacts every aspect of your life, which means it also impacts your autonomic function. So all of those automatic reflexes like swallowing, breathing, temperature control, all of those things that people take for granted, reflexes, they don't work properly. And as you can probably imagine, given the fact that all of your systems are impacted, that can make it extremely challenging and difficult to get a proper diagnosis. Because of the way our healthcare system is set up and each doctor focuses on a different thing. So, for instance, a neurologist is going to look at your brain and your neurological function, your spine, things like that. A rheumatologist is going to be focused on your joints and that nature. A dermatologist on your skin and hair and nails. A hematologist for your blood, a GI doctor for your GI tract, and so on. So, as you can probably guess, if each specialty is only focusing on their specific area of expertise, which obviously is understandable, that's what they specialize in, it misses that whole big picture. So when your entire body and all of your systems are impacted, but you're only looking at a teeny tiny piece separately for each system, it's kind of hard to connect all of the dots and get the actual issue causing everything, because you're only focusing and treating each thing, which impacts the other things, and so on. So that is why the average diagnosis, even today, now that more people are being diagnosed with it and more doctors are aware of EDS, it still takes on average 10 to 12 years to get a diagnosis. I do think it bears mentioning that there are 13 subtypes of Ehlers-Danlos syndrome, and there's actually a 14th subtype that's kind of thrown in with it, known as hypermobile spectrum disorder. For 12 of the subtypes, they have isolated the specific gene mutation that causes those subtypes, so those can be confirmed through genetic testing. The hypermobile type, which is the type that I was confirmed as having, does not yet have that isolated gene identified. They are working on it, and I am actually part of a research study through Mayo Clinic to hopefully help identify that in the future so that it will be easier to diagnose for other people. But there is a very specific, pretty lengthy criteria that has to be met in order to have the hypermobile type confirmed. So that's the process that I just went through at Mayo Clinic. And again, I'll discuss that in a future video. I'm not going to get too into the weeds as far as diagnosing and all of that. I just kind of want to give a brief overview of what it is, my story and experiences that have led me to this point, and what's going to happen next for me. But again, just wanted to put that out there. I'm just going to be focusing on the hypermobile type today. In my specific case, I can go back all the way to pretty much infancy to see now in retrospect all of the different signs and indications throughout my entire life that led to this diagnosis. For instance, as a baby, I had really bad chronic ear infections. I mean, like back to back to back. And again, your eustachian tubes are part of your connective tissue, so that defect is what was responsible for those. I just didn't know it at the time, and I actually needed tubes put in surgically twice. Normally, if you do need tubes in your ears, one and done is typically it. But now, looking back, I realized that they failed the first time because of my faulty connective tissues. So I did have them put in twice, and I've still struggled with inner ear issues my entire life, even after that. All throughout my childhood, I would get really, really severe growing pains, which, again, were passed off as normal. So I just thought it was, I was just one of the unlucky ones that had really bad growing pains. I had lots of injuries as a gymnast, mostly to my ankles, hips, those connective tissues and joints. Lots of creaking and cracking and joint popping. And what I now know, which I did not know was a thing at the time, I would get a lot of joint subluxations, which is like a partial dislocation. So like I can pop my shoulders in and out of place. Every time I move, my joints are creaking, cracking, my knuckles, my ankles, my knees, my hips, my toes, you name it. I have always been a creaky person. And again, just thought it was normal and just thought, I'm just extra flexible, which was a positive in gymnastics. So I never really associated that with being a defect or a problem or an indication of a problem. But it wasn't normal, and it did probably lead to a lot more damage to my body since I didn't know that I was supposed to be not overextending and overstretching and the things that I've done my entire life. So there were also other indications, like I temporarily, for a year or two, ended up developing asthma. I was temporarily for a couple of years in like the end of elementary, beginning of middle school. I became lactose intolerant and just could not have any dairy, and then it just went away. Just kind of random weird things like that. And then in middle school and into high school is when I started really developing more serious GI issues. I actually had to be hospitalized during high school for just chronic vomiting. I would have these stomach spasms and I would just uncontrollably vomit for like hours. My stomach would just, keep, even when there was nothing in it, I just couldn't stop the spasming and, those issues. They never found a satisfactory reason at the time. They ruled out all of the major things and just settled on it being IBS. I developed endometriosis, which is terrible, much more painful than either of my births. I mean, the worst pain I've ever had in my life. So if anybody out there suffers with endometriosis, you know what a horrible thing that is. But that resulted in me, after having my daughter, my final pregnancy, ended up getting a total hysterectomy. Again, all of that is very typical in EDS patients as well. Later in middle school and high school is also when I started really struggling with anxiety, depression, all of the things that I now know were caused from EDS. The majority of people with EDS do struggle with anxiety and or depression, at least during periods of their life. And that's probably why, which a lot of chronic illness patients can relate, a lot of doctors are so quick to pass off all of our physical conditions and chronic issues as being stress-related, anxiety-related, like, oh, you just need to sleep more and reduce your stress and you'll be fine, kind of a thing. Well, really, it was the physical issues that were causing the stress and causing the anxiety and depression, because you have such a constant state of heightened cortisol in your body, which is, stress, physical stress. So when your body is literally under stress 24/7 and is never able to fully relax, rest, and recover, naturally that leads to heightened stress, resulting anxiety, and, all of the mental health struggles. So, which is often what I would catch myself saying to friends and family and doctors is, yes, I have anxiety. Yes, I struggle with anxiety and depression, but that's not what's causing the physical issues. It's all of these physical issues that I don't understand and can't get a handle on that are making me have anxiety and depression. And it turns out I was right. So fast forward to 2019, and towards the end of that year is when I first started having kind of multi-systemic, unexplained symptoms and issues. I would run a low-grade fever for weeks at a time. And I actually ended up being hospitalized in late 2019 with what I now believe in retrospect was probably one of the first strains of COVID before we knew COVID was a thing. And that was when my first tachycardia and other heart issues, my shortness of breath, and things that started to seem more kind of like autoimmune, full body type issues kind of arose, which is ultimately what ended up leading to my diagnosis of thyroid cancer, because while they were trying to figure out what was causing all of these weird symptoms, even after I was discharged from the hospital and even after, the pneumonia, they called it atypical unspecified pneumonia that didn't really act like pneumonia, but they couldn't figure out what else it was. So again, I really think it was COVID, since we all know that that's very vascular. But anywho, the symptoms did not go away even after the fever did and the antibiotics and all of the treatment. They couldn't figure out why my vitamin D and potassium couldn't be managed, things like that. So they were doing all of these labs and testing, and that's when they came up with all of these abnormal thyroid findings. And when they looked closer into it, found the cancer, which I do think ended up being a positive thing, because I think if they hadn't have been testing for everything, that would have gone unchecked a lot longer and could have potentially spread and been a lot worse. So I am very thankful that as a result of all of my other weird symptoms, I caught that early and got rid of it ASAP. And then unfortunately, even after the cancer was removed, my symptoms like my tachycardia, where I would just get these crazy spikes in heart rate for no reason, like I would just take the trash out to the curb and my heart rate would be like 130 and I would be panting, and so just really weird things kept happening and kept progressing even after that, which, as you can imagine, was really frustrating, because here I am thinking, like, I survived cancer. Phew, things are going to get better now. I'm going to be able to live my life. And I was still having all of the same weird, unexplained symptoms that I was having before I was diagnosed. So that was definitely frustrating. I also started experiencing hair loss and getting these really weird skin rashes out of nowhere. And like I would just be itchy. I would get hives. I started getting really bad rash up and down my feet and my hands. And when I was getting tested at the dermatologist, I was diagnosed with lichen planus, as well as alopecia, which explained the hair loss, and also unspecified hair loss and dermatitis that didn't fall into either of those categories, but was some type of weird allergic reaction type thing with my skin. And the dermatologist even said at that point, I really think this might be more of like a connective tissue, autoimmune type response, because we do see these conditions pop up with other autoimmune conditions a lot. So that was kind of when I first started looking into that as a possibility. Around that same time is also when I began having all of my vocal dysfunction issues, difficulty swallowing. I would get the sensation that I was wearing kind of a turtleneck around my neck all the time, like a kind of squeezing sensation, even when, there was no reason for it, which not a fun sensation. So I, saw an ENT. I found out that I had a paralyzed vocal cord. They kind of was just like, oh, it's probably a result of your thyroid surgery, maybe some scar tissue. I wouldn't worry about it, not a big deal. We can do further testing, but there's really no reason to. And since it was so expensive at the time, I just thought, oh, if it's nothing to worry about, I'll just deal with the froggy voice and, hopefully it'll get better on its own, which, as we know, has not been the case. Although vocal therapy this last year has helped some. Still, when I get really fatigued or I'm not feeling great, it starts to get, a little gruff again. So still a work in progress, but obviously the least of my worries. So I started treating the lichen planus, got that under control with medication. Still would get the shortness of breath and the tachycardia from time to time, but it seemed to start kind of improving. It wasn't as disruptive to my life. I was able to start hiking again. I was able to get out and photograph. That's when I first started car camping and then launched my YouTube channel. And then now we are back in 2023, and I did get COVID in August of 2023. And honestly, ever since then is when things just kind of took a downturn. Some of you who have followed the channel for a while will probably remember that when I went on my big road trip in the fall of 2023, up into the mountains, going back into the Smokies, North Georgia, and was doing that whole circuit to see the fall colors, I had to cut that trip short because I just wasn't feeling myself. And then that very next week, I went out to go for a hike, and I almost passed out like a 1/10 of a mile into the hike. I suddenly got so fatigued. My arms and legs just felt like they were going to fall off. They suddenly got so heavy, I couldn't even lift them and barely made it back to the car. I cut that camping trip short, and I immediately went to the doctor the next week, and I was like, something is not right. And it was basically from that point through all of 2024 that I just progressively declined worse and worse. I lost the reflexes in my legs. I started having balance issues, my brain fogginess, my shortness of breath, my memory. I mean, everything just was tanking to where by the summer of last year, I was pretty much bedridden for most of the time and pretty much non-functional. I mean, it was an effort just to shower, just to get out of bed and get dressed would wipe me out for the day. I ended up having to stop working, and unfortunately, it was 7 months of just not being able to work at all, which was a whole other stressor in and of itself. And that's when the constant doctor's appointments started. Every test you can imagine. I mean, I was a constant pincushion. I took so many vials of blood, EEGs, EMGs, EKGs, ECGs, 24-hour monitors, chemical stress tests, swallow function tests, lung function tests, things I'd never even heard of. I mean, they were throwing the book at me. And all of my tests were either coming back normal or abnormal enough to show, yeah, there's definitely something going on, but we can't tell what it is. And the common theme that has been popping up for the last, year now was, it's got to be connective tissue. It's got to be connective tissue. Your rheumatologist is going to have to figure it out. Well, the rheumatologist was testing for everything. Lupus, Sjogren's. I had a positive ANA and I did have abnormal labs, but none of the antibodies or other tests that would confirm any of those connective tissue diseases were confirming anything. After multiple MRIs and CT scans and X-rays, MRAs, they knew that I had, from my brain scan, they knew that I had at some point, I think it was probably in early 2024 when things started getting really bad, but I don't know for sure. But either way, the MRIs did confirm that I had had a prior stroke. I was having really severe chronic migraines. Sometimes I would lose my vision with them. It was just really scary, really debilitating symptoms. And from strictly a symptom standpoint, everything was really pointing towards something either like systemic lupus or MS. Just with all of my motor function issues, balance issues, like the shakiness and the difficulty walking and my limbs not working right and the spasming and the tremors. And I mean, it wasn't making sense why they could tell that the symptoms I was having and the fact that I had no reflexes left in my legs, they knew that there was something going on that I was not faking, but nobody could figure out what it was. So after ruling out all of those things and still finding other kind of secondary diagnoses like the fibromyalgia, the GI issues like the Barrett's esophagus, the esophagitis, they could tell that my stomach muscles and my GI tract were spasming and not functioning properly. And so all of these doctors, my GI doctor, my neurologist, my dermatologist, my cardiologist, they were all saying you've got to have some type of connective tissue disease. But the rheumatologist was saying, you don't have any connective tissue diseases according to your labs. So that's kind of when I started just researching connective tissue issues. And when EDS popped up, it was like a light bulb went off. Everything clicked, everything fell into place, no pun intended. And I was like, oh my God, this is me. Literally this describes my whole life. It answers everything. I started reading that they had linked EDS to people also having a strong occurrence of endometriosis, of thyroid issues, it was just literally one thing after another. And I was like, this has to be it. So fortunately, I had already had my follow-up with rheumatology up at Mayo. And I brought it to her in May. And I said, I really think that this is it. It's the connective tissue piece that's been missing. It literally answers everything. It explains my entire medical history. This has to be it. And she was like, well, let's do the hypermobility test here. And I scored a perfect 9 out of 9 on their hypermobility scale. And she was like, okay, I think you might be onto something. Let's get you in with our EDS clinic and see if they can confirm it. And that's where I was this last week. And I don't want to brag, but my EDS doctor called me an overachiever because I hit so many of the criteria. So she was like, yeah, there's no doubt. We've got it. That's the answer. So now that we know what it is, we can move forward with a better treatment and management plan for you. Now, the thing with EDS is there is no cure. There is no fixing it. There's nothing that will make it go away. But in a lot of people, it can be successfully managed. And actually, some people with EDS remain largely asymptomatic as far as debilitating symptoms for either their whole life or until something kind of activates it. So, it doesn't have to be debilitating for everybody that gets it. I feel like I'm kind of a middle of the road, moderate case, because I do have significant impairment and dysfunction. Thankfully, thanks to Mayo's pain rehabilitation clinic that I went to in November, which was a very intense Monday through Friday, 8 to 5 full-time job for those 3 weeks, where they combined physical therapy, occupational therapy, behavioral therapy, diet, everything all at once, kind of like a boot camp. That made the biggest difference in my functionality, but it did not eliminate a lot of my symptoms. So even though I was able to get off of a lot of my medications and I was able to reduce a lot of my symptoms and drastically improve my functionality, I was still frustrated by this spring at the fact that a lot of my joint pain seemed to be getting worse again. You know, my swallowing, my voice function, my GI issues, they weren't getting better. And I was thinking, like, I'm doing everything right. I'm working the program. Like, why are some things still getting worse? And it was very frustrating. I mean, I'm grateful that I was able to go back to work full time, that I can cook and grocery shop and do most days everything that I need to do still. So don't get me wrong, I am so grateful about that. But it was still so frustrating to be like, well, I don't understand why certain things are still getting worse. So now that we know this piece and it's been confirmed, I can kind of move forward with a more custom tailored management and treatment plan that will help with this known condition. And hopefully that will help with some of these other symptoms. And it's crazy to me to think that if I hadn't have decided to do this research into these other connective tissue possibilities, it probably never would have clicked, and it probably would still be quite a long time, if ever, before I got this diagnosis. It was really that hypermobility piece that kind of made everything else make sense, because again, this is something that I've had my entire life and never realized or associated it with my health issues. I just thought I was extra flexible, and I had always thought that was a good thing when I was a kid, so it never even crossed my mind to even mention the hypermobility part. I'm sure if I would have last year brought up the hypermobility once I got to Mayo and first started seeing the rheumatologist and the neurologist there, it probably would have made a little light bulb go off for them to say, hey, let's get you tested for this. But they didn't know, and they didn't really ever test my joint mobility. So, you know, it's not like I ever went in and was like, hey, look what I can do with my fingers, guys. Is this related? Because who would have thought? But it was that piece when that popped up in my research that I was like, oh. And then that's all it took once I, added that component to it for them to get me to the right people. And my EDS doctor is amazing. It's so nice to have these doctors there that all talk to each other. They read your entire chart and all of the updates, so you don't have to repeat yourself a million times. They confer with each other. So it really feels like they want to help. And I just finally, for the first time in my entire life, 40 plus years, I feel validated and seen and heard from a medical healthcare perspective, which is huge, because I'm sure a lot of people with chronic illness can relate. Hold on. All right, I had to gather myself there. But I'm sure that we can all relate to how frustrating and demoralizing and hurtful and upsetting the medical gaslighting can be. To be constantly blown off or told, oh, it's just stress. Oh, it's just anxiety. Oh, it's nothing. It'll get, you really do start to feel defective and like, what's wrong with me? Like, I know there's something wrong, but everybody I'm seeing is just blowing me off. So to finally be at a place where I feel like I have a care team that actually cares has made all of the difference. And it's not lost on me what a privilege that is and how lucky I am, because so many people do not find those providers. So, it was a combination of me finally learning how to advocate for myself and to kind of take more of a hands-on approach in my own healthcare versus just relying on providers, and then finding the right providers. That really has made all the difference. So what does all of that mean and what's next for me? Well, now that I have gotten into the EDS clinic and had my initial evaluation and my diagnosis confirmed, the next step, aside from me I still have some cardiology testing and a cardiology evaluation there. I'm also going to be meeting with the POTS clinic to address my dysautonomia or my autonomic dysfunction. I don't believe that it's the traditional POTS, because well, again, I'm not going to get into all of the specific details and diagnostic criterias and stuff in this video, but I definitely have autonomic dysfunction, so they are going to be addressing that further to see if they can kind of isolate and identify that for potential treatment options there. So I do have all of those appointments still. I am also going to be meeting with the physical therapist there that specializes in EDS, because it's very important to not overextend or overstretch or put too much strain on my joints to make that work. But it is very important that I strengthen my muscles more so that my joints don't have to work as hard and so that my muscles are not as exhausted trying to hold everything together. So I am going to be meeting with the EDS physical therapist. I am also going to be meeting with the EDS occupational therapist for potential modifications. I may need some braces and splints and posture correction devices, those types of things, at least occasionally. I'm really hopeful that I don't end up needing eventually down the line any kind of mobility aids, because I do know a lot of EDS patients do end up needing mobility aids like walkers and things like that. They also sometimes end up needing like feeding tubes and TPN, which is like intravenous nutrition if the digestive tract or GI tract ends up failing. So, those are kind of concerns and things that it's hard not to stress about in the future, but I'm hoping that I finally caught it in time to come up with an effective management strategy that can hold that progression off. So, again, it does make me nervous that I've been having more issues with swallowing and eating and drinking and stuff, but I am not going to dwell on that. I am just going to work on, whatever tips they're giving me to help with that. So once I meet with the PT and OT there, and then a few other things, my echo also turned up a potential issue that I'm hoping doesn't need surgical intervention, because nobody wants to get heart surgery. And I have a few other tests like that to kind of rule out more serious issues with some of my internal organs. So once I get through all of those appointments and my medical team can get back together and talk, there's also like a full day seminar that goes over specific kind of like diet tips, just all different kinds of management strategies to help people with EDS. So once I go through all of that in the next few months, I'll meet back with my EDS doctor, and she'll have kind of like a formal, custom tailored management strategy, and we'll potentially talk medications and other treatments that might help once they have a better, bigger, fuller picture of everything. So I definitely feel like I'm in the best hands possible. I feel so grateful to have such an amazing, awesome, caring, empathetic medical team. It also really helps that my EDS doctor also has a lot of the same conditions that I do, so I know that she can actually relate and understand on a level that a lot of physicians can't, which makes a big difference to me too. So I really do feel like I'm on the right path finally, and that I'm really hoping that everything that I learn and experience can also help other people if I can share that with you guys. So definitely stay tuned. I know I've been rambling for a long time, so I'm going to wrap this up, but I just kind of wanted to sum everything up for you, let you know what's going on, cheer the fact that I finally, after 44 years of life, have a name and a diagnosis that explains my whole life. And I mean, to me, it makes a huge difference from a mental standpoint to not feel like, why are all of these random things happening to me? Like, what's wrong with me? I'm trying to do everything right and I'm still falling apart. So now that I know there's a reason, and now that I can actually understand everything going on in my body and everything that has gone on in my body, it makes me feel stronger and more capable to deal with it and, to just face it head on. So if you want to know more, follow along. I'm not going to only be doing videos about this, I promise. In fact, the next video up is going to be a car camping video that I filmed like a month ago that I just have not gotten around to editing and uploading. And of course, I'll have more tips and tricks for car camping and all of that. So if that's why you are a member of my channel and part of my community, do not fret. There will still be plenty of car camping and adventures and other material like that coming up. But I am also going to be including my experiences, what I learn, what's working for me, what isn't. So if there is anything specific you'd like to know, make sure that you leave it in the comments, and I will see you again soon. Bye for now.